My name is Cecilia Alcala, and my pronouns are she and her. And I'm a postdoctoral fellow in the Department of Environmental Medicine and Public Health at the Icahn School of Medicine at Mount Sinai. I recently co-authored a paper titled An Applied Environmental Justice Framework for Exposure Science, which was one of the recommended readings for this forum. Our paper sheds light on the principles of environmental justice established at the first National People of Color Environmental Leadership Summit in 1991 and proposes an environmental justice framework for exposure scientists to be implemented in future research to be centered on the community it seeks to serve. This project was a labor of passion for the communities we serve and represent, which is why it is an honor to introduce our last speaker of the day, Dr. Sacoby Wilson. Dr. Wilson is a professor with the Maryland Institute for Applied Environmental Health and Department of Epidemiology and Biostatistics, School of Public Health, University of Maryland College Park, and the director of the Center for Community Engagement, Environmental Justice, and Health. Dr. Wilson has over 20 years of experience as an environmental health scientist in the areas of exposure science, environmental justice, environmental health disparities, community-based participatory research, water quality analysis, air pollution studies, built environment, industrial animal production, climate change, community resiliency, and sustainability. He works primarily in partnership with community-based organizations to study and address environmental justice and health issues and translate research to action. Dr. Wilson will give a presentation about liberation science and how it can be used to build communities of resistance within community academic research partnerships. Thank you so much, Dr. Wilson, for creating this space and for being here. We're looking forward to your presentation today.
Thanks for having me. How much time do I have again?
I think we had said 25 minutes for your presentation with 15 minutes for discussion.
Ooh, I'm gonna have to, okay. I have way too many, so it's like I overdid it. I overdid it, y'all, but I'm gonna try to, I need to find somebody text me, keep me on time. I'm already wasting time. Let me do a share screen for y'all real quick. Hold on a second. So thanks for having me. Thanks for that great introduction. I'm really excited to be here. I appreciate the opportunity to learn about rest for liberations. I do not rest. I do not get any sleep, y'all. My joke is not just I'm a robot. I'm stealing energy from other Sacobys in the multiverse to keep this work going. So I gotta fix that, don't I? So just to share screen real quick. Here we go. Yeah, up for work. So I'm gonna talk about today in the 22 minutes that I have, the use of empowerment science and liberation science to advance environmental climate justice and achieve health equity. I'm gonna go a little fast. I'll try not to touch all the slides. And if I'm getting close to being too many minutes over, just cut me off, y'all. I get into my head sometimes. So we have to talk about racism. Racism is embedded, my pronouns are he, him. I mean, I'm on the lens of Piscataway people. So we think about racism is America's apple pie. You can't talk about addressing these issues that we're talking about in all parts of society, but talking about structural racism, right? So we have to talk about the racism in regards to the stolen lands of our indigenous brothers and sisters, right? And also the stolen bodies of our African brothers and sisters. I'm a descendant of enslaved Africans. I'm also indigenous and Anglo, right? So we're talking about bringing our full selves to this discussion. I want to recognize that too, but we have to talk about racism, right? We have to talk about racial capitalism. When John Lewis was eulogized by Reverend Lawson talked about plantation capitalism, right? He talked about plantation capitalism, the fact that, our country is built on racial capitalism, the exploitation of certain groups, right, of their bodies. And this has been, it wasn't, just with slavery. This is something that was brought here from Europe, putting people on racial groups, doing their feudal system and otherizing them and marginalizing them. And so, AMBA strategic plan to address racial justice and advance health equity notes that racial capitalism promotes competition and exploitation of natural resources, leading to the destruction or depletion of resources, leading to widening inequities for Black, Indigenous, and other people of color, folks in the global majority. And this is a cycle of structural violence, right? I think Dr. Paul Farmer, who recently passed, talked about some of these issues, right? And so if you're going to talk about, racial capitalism, in my work, you have to talk about environmental slavery. Because in many ways, you think about this environmental justice movement is a movement against environmental racism. But I was going to say environmental racism is too soft of a word. It's not strong enough for what people actually experience. They experience environmental slavery. Environmental slavery is connected to racial capitalism, okay? If you think about, after the Civil War, freedmen's, the transition, Reconstruction, Jim Crow, right? We're dealing with the old Jim Crow, but we're dealing with new Jim Crow now. So communities dealing with environmental slavery are ones that have been exploited. They internalize environmental disamenities, externalities. And this happens through inequities in planning, zoning, development. Racism and privilege embedded in planning, zoning, development. Look at redlining, look at segregation. The National Highway Defense Act, 1956. Let's talk about this other day on a panel about transportation racism, actually 2 nights ago, right? You think about the issues of food apartheid, medical apartheid. All these things are connected, where some groups benefit and some groups don't benefit, right? Exploitation of natural resources, I just said, AMA. Some folks are dealing with environmental harms, and some people get more environmental goods, right? And then these communities that are dealing with environmental slavery get stuck. They get destabilized. They become geographically, socially, economically bounded. People can't get out. People can't get out because of the infrastructure. And again, this is connected to racial capitalism. And then the footprint of those dominant groups is felt every day. So if you have privilege, class privilege, white privilege, what kind of privilege, your footprint is felt by these communities every day. It impacts them across their life course, and it impacts them intergenerationally. That's environmental slavery, environmental apartheid, environmental oppression, sacrifice zones, toxic trauma. That's a lot of strong negative words. I got some positive words in what was part of this discussion. Some of the rest, right? They bring the liberation. We'll get to the liberation part, right? And then you think about the EJ movement. So the environmental justice movement, Dr. King, all y'all know Dr. King, grandfather, in my opinion, of the environmental justice movement. The assassination when he was in Memphis, was it now 54 years ago? Still May, last month, April 4th? He was talking about people being dehumanized, right? We're talking about environmental injustice, environmental slavery, how folks have been dehumanized. We're talking about liberation. We're trying to fight for people's humanity. You see the sign? Black men were carrying around signs that said, because of the way we're being treated, I am a man, recognize my humanity. So would it be school to prison pipeline, little black girls and black girls and boys being arrested for having a temper tantrum? Thinking about when I was a little kid, I got suspended from school 9 times. I wonder what would have happened to me in today's stuff, because I was dealing with racist bullying in Mississippi. Y'all know the song, Mississippi Guy, I ain't gonna say it. But y'all know the song, I'm not gonna say it. But growing up in Mississippi, dealing with racism, also my alopecia, etc. What would happen to me today? And then how the black faces, white spaces, driving while black, coupon while black, Starbucks while black, in your house playing video games while black, in your house mind your business, eating ice cream while black, taking subways home while black, carrying a permit while black, in the store mind your business while black, in Buffalo just shopping while black, and getting murdered by a white supremacist while black. That trauma, I experienced it. Charleston church murder, supremacists, trauma, I experienced it. Seeing people being run down, trauma, I experienced it. People running away or minding their business, walking, trauma, I experienced it. Seeing all these things on the news every day, trauma, I experienced it. We need liberation. Y'all know about the history of the EJ movement. Actually, for those who don't know, this year will be the 40th anniversary. September, this should be the 40th anniversary of the Warren County PCB landfill fight. Those in North Carolina, so if you're not already planning stuff, NIEHS, with our community partners down there, hopefully y'all already are. Just this little shout out, a reminder. But you think about some environmental slavery issues, talking about North Carolina, industrial hog farms. My mentor, Dr. Wing, who passed about 6 years ago now, went on 6 years ago now, he did work on industrial hog farm in North Carolina. And the reason why I just show you this map, look at the next map. Look at the bottom map, right? Then look at the next map, y'all. We talked about this map back in 2015, I believe, like Sacoby. He said, Sacoby, what about if I overlaid the hog farms and look at the enslaved Africans in 1860? Would that be relevant? Yeah, Dr. Wing, because I talk about environmental slavery. That what's past is prologue. Why it looks this way is not by accident. Decommodified, dehumanized, and still been dehumanized and dumped on and extracted from, colonized, can't say the word, you don't get what I'm saying, today, talking too fast, today, right? Uniontown, Alabama, y'all know Selma. This place is about 20 minutes from Selma, 25 minutes from Selma. That first photo, you see that mountain? Y'all remember Kingston, Tennessee? The coal ash spill some years ago, white community, they put it on the railroad, they put it on a train, they took it to the black community. Well, this is the black community they took it to. 4 million tons of coal ash. 4 million tons. And they built it on top of old plantation cemetery. We don't care about the living and we don't care about the dead. When they flush their toilets in Uniontown, when you flush your toilet, your waste goes to a sewage treatment plant. When they flush their toilet, their waste goes to a containment pond and they spray it. So what you're seeing being sprayed is human waste right there. Per capita income, $12,000 a year. Economic apartheid, y'all. Environmental apartheid. Katrina. I just want to say real quick about Katrina. Y'all know Hurricane Ida hit New Orleans last year on the 16th anniversary of Hurricane Katrina. Why is it relevant to this discussion? Think about folks who are enslaved African descendants. Where could they settle with? Y'all know lower wealth of folks of color in New Orleans live in a lower elevation. So they easily hit by hurricanes. So again, what's past racism, contemporary past racism impacts with current racism, right? Black butterfly in Baltimore. Why I'm talking about it again, we're talking about racism, racial capitalism. And the wings are all the Black folks living in the east and west parts of Baltimore, hyper segregated. Y'all know that Baltimore was first city in the country that had racism-based zoning. It got thrown out by the Supreme Court, but that got baked into the systems. Remember, racism is baked into the walls of our housing, transportation systems, food systems, political systems, economic systems. And look at life expectancy. You see a spatial relationship between redlining and life expectancy in Baltimore. Asthma, air pollution. You see a spatial relationship. It's called planning, not accident. That's a quote from one of my colleagues, Dr. Carlton Elley, frat brother of mine. He's a planner. He said, this is not about accident. Embedded racism, okay? So we talk about this racism and environmental justice. You got to talk about scientific racism. It's connected to racial capitalism. Whose knowledge counts? Who says it counts, right? Who's considered valuable in the field, right? Dr. Bullard talks about your complexion for protection. Your skin color is very important. Skin color tends to be very important in scientific research, right? We forget some of the historic figures, the hidden figures, right? The movie, all the folks did this great work, but we ignore them. We otherwise them, we invisibilize them in science. Perpetuate white supremacist capitalist culture. This is from my essay that we wrote online on Medium about scientific racism, colonialism, imperialism. Perspective of low wealth, Black, Indigenous people of color get devalued. We erase their scientific contributions. We impede real world application of scientific knowledge, and we exploit Black and brown bias in scientific research. I ain't got to name it, but I will name it. Tuskegee, Kennedy Krieger led study, HeLa cells, Johns Hopkins. I'm not just picking on Johns Hopkins, there's Hopkins a few of those. There's some others out there as well, right? But we keep exploiting Black and brown bias in research. And then we say folks don't have the intellect to be scientists. So scientific research is truly anti-racist. We would try to use science to really address world problems instead of trying to figure out what's going on inside with mechanisms. Yeah, I'm jumping on biomedical research right now. I apologize, not really. And reductionist science, because instead of clean the air, clean the water, clean the soil, give people access to safe food and water, right? And addressing transportation issues, we want to find out what's wrong with your Jordache genes, your lead genes, et cetera. Environment's the gun, genetics the trigger. Deal with the social determinants of health, the upstream factors, and we won't have to spend so much money studying the mechanisms. And that, to me, is racist research, in my opinion. You think about scientific racism, racism has to be maintained in order for it to be sustained. So we have racial capitalism system in this country. We have racial capitalism in our research industrial complex, y'all. Who controls it? Right? How do they control it? This becomes multi-generational. So who's superior, right? Some people are discouraged from moving into these scientific spaces because we have to deal with microaggressions and macroaggressions, being otherized, imposter syndrome, devalue our lived experiences. I'm sorry, y'all. All of us have bias when it comes to doing research. And our lived experiences inform the research that we do. So there's truly no objective science. Just to let y'all know, if you grew up near a butterfly farm, you do butterfly research today, there's nothing wrong with that. Let's be real about it. I grew up near what? A landfill. I grew up near what? A sewage treatment plant. I grew up near what? A major highway. I grew up near what? A concrete facility. I grew up near what? 20 miles from a nuclear power plant. My dad was a pipe fitter working at these facilities, coal-fired power plants. I used to walk to my high school on the railroad track. Y'all know what I'm talking about. By the landfill. Ride my school bus home, by the landfill. That's why I do the work that I do. Because I want to actually use science for change. Okay, let me keep it moving. So going through all this stuff is exhausting when you're otherwise because of your lived experience. You're otherwise because of your cultural background. You're otherwise because you try to use science to solve problems. Wow, using science to solve problems, that's a novel concept. Let's keep it moving. So you think about the lack of heterogeneity in scientific perspectives and not having enough BIPOC researchers, it kind of reaffirms this inferiority in some complexes. And that's a problem. And disposability of Black populations. Oh, we just study you. Oh, just need to have one Black person or a Hispanic person. We just need one of you on the team. We get tokenism. And it marginalizes our expertise, and it also marginalizes our institutions, our HBCUs, our TCUs, right? Hispanic service institutions, our APIs. So the lack of diversity in scientific research affirms because white folks don't see us. So, well, you're not here, you must be inferior. That's not right. That's not true, okay? People of color comprise a mere 20% of all tenure track faculty in America. Here's some other stats. I have too many slides, but let me just go to the next slide. One of the points when I talk about colonialism, we keep studying these problems over again, but we're not solving them. We have 40 years of research on people dying from pollution, food insecurity, but our scientific practice, colonial practices, haven't stopped these things, right? So we keep doing studies. Knowledge, need more knowledge, Sacoby. Oh, we want to focus on innovation. We need more innovation. That's another word I don't like, innovation. If it's not leading to change, innovation is just another fishing expedition. Just to let you know, that's how I feel. But what do I know, okay? So we got all this work out there, but why aren't we addressing the root causes, right? Why aren't we addressing these inequities, okay? I want to focus on that. I have other things on the slide, but I'm gonna keep going because I got way too many slides. And then you have scientific imperialism. Just to translate it quickly for you, you can read the text on the slide. Scientific imperialism when you have certain institutions dominate the research agenda. Whether it's certain primary white institutions or it's certain fund institutions who say this is the research that counts. They say here's the knowledge that counts, and they say here are the folks who count when it comes to doing the research. Now, I want to say that this scientific imperialism really impacts our ability to build capacity, our HBCUs and TCUs. And you have this issue of the Matthew effect. The rich get richer. You got primary white institutions that have billion-dollar endowments. I ain't gonna say any names. Y'all know what I'm talking about. I actually work with folks at the institutions. That's fine. But the rich get richer. And then when on the peer review process, I hear a lot of the peer review process. Well, I know the application is not great, but I know them. They do good work. I don't care if you know them. It's what's on the page, right? It's what's on the proposal, y'all. That's not fair. That's an inequity. I call that the pixie dust effect. If you have a certain name, because you're part of this scientific imperialistic infrastructure, you get extra pixie dust. Even if your proposal is not good enough, or even if you don't have the credibility in the space to do EJ work. There are a lot of folks, I ain't gonna call out names, who are doing EJ work who do not have credibility in this space. You're doing extractive science. Just because you study the problem, that's not environmental justice. Environmental justice is about action and justice. If you're continually studying the problem, that's actually extractive, colonial, racist science. I'm gonna keep it moving. But look at the funding, for example. HBCUs, and this is in a blog that we wrote, receive 3% of all federal funding when you compare to other institutions of higher education. I'm gonna let this sit for a second. That's a problem, y'all. I have another figure in that blog on Medium that said of funding from 4 federal agencies, I believe USDA, NSF, EPA, and one other, maybe Department of Energy, 4. 20 primary white institutions received, I think, 30% of the funding from those 4 federal agencies. Okay, that's scientific imperialism. Now, don't want to spend too much time on health equity tourism, but this is a practice of new investigators coming into the space, saying we want to do this work, and they do it because it's new funding, it's exciting. That's environmental justice right now. Everybody, the grandma and the great-grandma, great-grandpa, they want to do EJ work. When last year, they didn't care about EJ work. Some of y'all don't know rap. This is the old rap song. I'm dating myself. This is a song by Mike Jones. There's a lyric. Y'all know the lyric. Last year you didn't know me. Now I'm hot. You all on me. There's a lot of folks. That's health equity tourism research. And now it's hot. You switch your whole agenda. You go from conservation to not doing EJ. You go from planning to not doing EJ. You go from environmental education to not doing EJ. You go from doing whatever you're doing, genetic research, to not doing health disparities. But then you may be a primarily white institution that's part of the scientific imperialism, and because you're at the institution, you get the funding. Even though you have no expertise, even though you have no credibility, even though you have the connection to the work, you haven't had no impact, and that's a problem, y'all. It's a problem. Again, it's colonial, it's extractive, and it's a part of this whole racial capitalism. Now, this is a provocative title, the slide. It sounds like NIH racist. I just want y'all to ponder that. I know the other folks will talk about it after me, and I gotta, again, let me know how I'm doing on time, because I got 50 more slides to get to. I'm joking, but way too many slides. But basically, the data shows in the slide that there's a big difference in R1s between Black faculty, Black researchers, and white research, principal investigators. 2011, and looking at the percentage, 50% of that for white applicants from 2014 to 2016, when you look at the probability of getting a R1 award. And I would say personally, I didn't want to put in too much personal stuff, but I'm gonna tell the story real quickly. I haven't received NIH funding, and this specifically NIEHS funding, since 2011. I'm supposedly a top expert environmental health scientist in EJ. I haven't received the R1 in 21. You probably say, Dr. Wilson, will have you applied? Of course I have. And I want to say I've gotten back feedback, well, it's about your grantsmanship. I'm sorry, that is nonsense, y'all. You have a process that is not fair, it's not equitable. And I'm gonna ask this question, I'll be running out of time, but this is to the NIHS team. Have you been tracking the number of R1s and center grants that have been led by Black faculty? I mean, folks from underrepresented groups in sciences, specifically folks are descendants of enslaved Africans, to be even more specific. Have you been tracking that? We want that data. In the last 5 years, in the last 10 years, in the history of NIEHS, R1s and center grants. That's part of the homework. We'd like to hear about that soon. Now, it's unacceptable that you have these disparities still to this day. And this is just quoting from this article by Taft and Gilpin. It's unacceptable that we still see funding rate differences. It's due to bias. And it's unacceptable that NIH is really saying, oh, well, it's your choice of topic is the reason. Because you're trying to do stuff on health disparities. And that's the reason why you're not getting funded. Right, and here's some more things about that's unacceptable from that article. And so I think, the Unite program in many ways is a response to what's outlined in this article. But question is where's Unite at when it comes to funding in environmental health spaces? So what can we do? We have to uprise against white supremacy, racial capitalism. We have to build a movement, a science movement, not just being a woke scientist, because all that wokeness for 5-6 years ago, and I'm not down with that. We have to really be in the business of liberation, as we've been talking about, as we learned today. And I think that's important. Empowerment science. We have a special issue, Luz and some other colleagues, we pulled together a special issue for the Journal of Environmental Justice. And we're talking about empowerment liberation science. So empowerment science is about connecting people, particularly those most impacted by social, racial, economic, environmental, and climate justice, to science and scientific tools. So building capacity, building critical literacy, building agency, building power, community power. and connecting people to the power they already have individually and collectively. So it's shifting power and research initiatives, right? And this comes from our special issue summary. And you have liberation. Oh, how many more minutes?
4 minutes, and then we'll have 10 minutes for discussion.
Okay, thank you. Thanks for giving me extra time, because I'm a talker. So this liberation science. Liberation science challenges traditional anti-Black, imperialistic, capitalistic, patriarchal, and white supremacist approaches to science, right? So we want to use liberation science to dismantle systems of oppression. And we want to really make sure we're doing liberation science to, free people from toxic trauma, sacrifice zones, environmental slavery, environmental racism, environmental apartheid. I mean, what are we doing science for if we're not actually translating to real action? Okay. And we need to integrate as NIH moves forward, and this is beyond Unite, integrate the 17 principles of environmental justice, as was stated in the essay one of the essays for the reading today, the 70 principles, right? We need to be talking about, as relates to environmental justice, how you integrate distributional justice principles into NIH, recognitional justice principles into NIH, and that's what empowerment science kind of focuses on. Restorative justice principles in the NIH, right? That needs to be, how are you doing that? That's important. We got to focus on exposure justice and equity. In a National Academy of Sciences report some years ago, Exposure Science in the 21st Century, I was one of the team who was part of that report. We talk about exposure justice. So how can we bring in exposure justice into our work, okay? Another part what we can do is focus on community engagement. I mean, one of the things about the 17 principles, communities speak for their own voice. You want to make sure those folks the most impact at the table. Community engagement, community engaged research is a part of that. We need to support community science. So CBPR, CDR, COMER, which I'll get to. I'm gonna probably run out of time, but I'll go quickly. So y'all know what CBPR is, but I think it's one framework that can be used. Here's some core principles. I think when we think about working with communities, you want to focus on quality processes and meaningful outcomes. Again, it's just not good enough to collect data. Did you improve the problem? Did you address the inequality? Did you give people access to food, to clean air, clean food, safe housing, safe water, right? Did you reduce the health disparities? Did you address climate change and add more trees to do more mitigation, adaptation? Did you make it more resilient, right? Did you help achieve health equity? Did you get to the so what? Data is not enough. You need to have transformation. It has to be transformative science, political, personal, community transformation, right? What are you doing if you're not transforming? Boyer's 5 dimensions. I'll just say, if you're not doing all 5 dimensions of science, you're doing incomplete science. It's just not good enough to focus on knowledge production, team promotion around publish or perish because you just produce knowledge. That's not good enough. You got to be doing engagement science and application science. And then when you're doing this work for liberation, you got to connect these issues that things are important to everyday folks. Food, faith, family, health, and jobs. How are you helping people in food, faith, family, health, and jobs? That's what's important to folks. Y'all know I'm always going to give a shout out to West End as it relates to the type of science we should be doing. Community owned and managed research. That's an example of liberation science. Folks are fighting against the highway in North Carolina and not having sewer and water infrastructure. Omega Wilson and Ware came up with this approach called community owned and managed research. And real quickly, equity and funding, parity and management, science for compliance, about action, legal epidemiology, not just looking at exposure disease relationships, but once you see exposure differentials, then is there compliance with Title VI? Is there compliance with the law, with building codes? They want action. That's what legal epidemiology is about. And we did this work, we did this community science work, and it helped daily bypass. It helped get people sewer and water infrastructure. An example in the Gulf Coast is the HBCU Gulf Coast Consortium. And the reason why I emphasize them, Dr. Buller and Dr. Wright used the community university model. Bring the community together with the university. That's a model we can look to. We're bringing in technology. Remember, empowerment science. Bring the technology to the people so they can collect their own data, tell their own stories. So we're doing air quality monitoring in Cheverly with low-cost sensors. We're doing it in Newark. We're doing it in Uniontown. We're helping in Savannah. We're helping in Charleston. We're expanding this across the Mid-Atlantic. We're developing apps, again, so people can tell their own stories, collect their own data. My Block Counts. We're actually going to start a podcast with one of the NPR stations, I think in July, around My Block Counts. So you can make this stuff local, make it real, make it everyday, make EJ proximal, liberating people where they are, where they live. You know, environmental is where we live, where we work, where we play, where we pray, where we learn. So you got to liberate folks in those spaces, right? Where we live, where we work, where we play, where we learn. I'm gonna say it again. I can't say it fast, but y'all get what I'm saying. Liberation is important in those spaces. And then we're developing mapping tools. Again, putting the tools into the hands of the people. So helping to do empowerment science, which leads to the liberation in the liberation science. And then we have executive orders on racial equity that we need to leverage. Climate change, justice 40 concept. 4% of the benefits go to disadvantaged communities. And for NIH, I know I'm over time, I apologize. For NIH and liberation to work out, expand, unite, more transparency, more data, fund impact, change the peer review process. Got a lot of bullets here, but peer review process needs to be changed. You got to get more folks on those peer review panels who actually do the work, who have the lived experiences, and who are part of the community cultural knowledge systems. And make sure people who are doing the work, they don't have to have a PhD to be on these peer review panels. Stop funding pain pippin science. Stop funding health equity tourism. Be anti-racist, fund anti-racist research. Fund community science. Implement the Coma principles in this work. Fund taxpayer science. Look at my signature, y'all. My signature says the people's money should be used for the people's science to get to the people's solutions. That's what we need to be doing. DEI should be prioritized, okay? And this 40% concept, Justice 40, fund, when it comes to 40% of the research dollars, should be going to folks from historically marginalized groups, folks in the global majority. 40% should be going to environmental justice, common justice organizations. 4% should be going minimum, that's the floor, HBCUs, TCUs, HSIs, AAPIUs. Have accountability metrics. And again, stop funding scientific racism, colonialism, and imperialism. I'll stop. I'm over time. I appreciate you. Pass the mic back.